عليكم.
Our subject today is two parts. The first part, I'll introduce the first part, biliary system, and my colleague Dr. Asma will continue the second part about the pancreas. We start first with the gallbladder. The gallbladder is a pear-shaped sac that consists from the fundus, body, and the neck, and attached to the extrahepatic bile duct by the cystic duct. Is located in the shallow fossa along the inferior aspect of the liver. Its measurements would vary from feeding and the fasting state. It is maybe up to 10 centimeter length with 3 centimeter width, and the wall thickness is about up to 3 millimeter. Its capacity is about 30 to 50 mil. On the ventral aspect of the gallbladder, just proximal to the neck, there is a pouch, appear only when the gallbladder is distended. It is called a Hartmann pouch. It is not considered as a part of normal anatomy because it appears only when the gallbladder is distended. The mucosal lining of the gallbladder is smooth, except in the neck and the cystic duct, where the mucosa appear in fold, arranged in the spiral arrangement to regulate the flow of the bile. It is called a valve of Heister. During ultrasound examination, you have to be careful because this area appear very echogenic and be mistaken as a stone lodged in the neck or the cystic duct. The anatomic relation, we have the anterior-superior relation, which is the gallbladder bed in the liver and the anterior abdominal wall. Posterior-inferiorly, we have the free edge of lesser omentum here related to the neck. We have the first part of the denum here related to the body, and the transverse colon that's related to the fundus. This is a variety of normal appearance of gallbladder. We have the normal and common pear-shaped appearance. We have an elongated gallbladder. Here we have an S-shaped gallbladder with multiple kinks, and we have what is called a Phrygian cup, where the fundus of the body is folded over the fundus of the gallbladder is folded over the body. This is normal appearance of gallbladder on ultrasound, showing the gallbladder and the neck with cystic duct. We have a gallbladder variance. This variance in morphology, maybe in number or position. We start with the morphology. We have what is called a gallbladder septum, which is a thin septum, maybe partial or complete, single or multiple, as we see here, that divided the gallbladder into intercommunicating compartments. See multiple septa. We have what is called a Phrygian cup, as we say, with the fundus of the gallbladder is folded over the body. As we say in ultrasound, maybe single or maybe multiple. It is of no clinical significance and asymptomatic. We have what is called a diverticula. This is a hernia-like protrusion, which is, the true diverticula, mainly from the fundus of the gallbladder. It's also have no clinical significance. This is the diverticula here and here. Now we talk about the variant in the position. We have what is called a supra-hepatic gallbladder, where the gallbladder is located an ectopic location over the dome of the right lobe of the liver. This type may be associated with the hypoplasia of the right liver or may be associated with right diaphragmatic hernia. As we say here, there is a hypoplasia of the right lobe of the liver, and there is the supra-hepatic gallbladder. We have what is called another type with the retro-hepatic gallbladder, which lie here, as we say. This type may be have the gallbladder have a mesentery and appear floating and take this type, or may be associated with the hypoplasia of the right lobe, the location of retro-hepatic gallbladder, and on the CT scan. An intrahepatic gallbladder. This type, the gallbladder may be partially or completely embedded within the liver parenchyma. This is the normal position once of intrauterine life. So if the gallbladder failed to reach the superficial position during the intrauterine life after delivery.
What's the significance of
نعم
this?
أستاذ.
What's the significance of this?
أستاذ العفو، إذا صار مثلا pain location أو symptoms of bladder
وبعد
within the liver parenchyma.
يعني قصدي مهم، احنا عادة ما نكتب البوزيشن مالت الجول بلادر. normal position. One have to put it down in the report. Why?
يعني دكتور، يعني atypical symptoms، يعني atypical sign of pain نعم.
intrahepatic. إذا ما تكتب له هذه intrahepatic تسوي له مشكلة.
نعم.
اوكي بابا، خلوها ببالكم. البوزيشن همينه is important of the gall bladder.
This is another type of intrahepatic gallbladder. See, there is a gallstone inside. We have a left-sided gallbladder. The gallbladder appear under the left lobe of the liver. This is maybe have a mesentery and herniated through the epiploic foramina, or maybe a type within a part of the situs inversus. As we say, a gallbladder under the left lobe of the liver. There's another case with the gallbladder under the left lobe of the liver versus where there's the liver and gallbladder on the left side, while the spleen on the right side. Gallbladder duplication, there's maybe a septic gallbladder, just a septum inside with the contour, normal contour of the gallbladder, or maybe there is a fundus duplication and appear as a Y-shaped gallbladder, but sharing the same cystic duct, or maybe complete duplication, but on the same side of the gallbladder, with each have a cystic duct separate of the hepatic duct, one on the right and the other on the left. This is a case of gallbladder duplication, another case of gallbladder duplication, and here on CT scan, a gallbladder duplication. Arterial supply, the main arterial supply of the gallbladder by cystic artery. Sometimes there is a direct branch from the liver at the gallbladder bed. Again here, this is the celiac trunk, this is the common hepatic duct, the common hepatic artery, sorry. We gave the left hepatic artery proper, left hepatic, right hepatic artery called cystic artery. The venous drainage, there is a small veins at the gallbladder bed drain directly to the liver, or sometimes when the cystic vein form, there is drain directly to the right branch of the portal vein. Lymphatic drainage, we have a three pathway for lymphatic drainage. We have the retropancreatic pathway, celiac pathway, and mesenteric pathway. Drain maybe the primary pathway of drainage is posterior to the pancreas to the retroportal lymph node, or maybe follow the hepatoduodenal ligament to the celiac lymph nodes or lymph node. Now we talk about bile ducts. We have, as you know, we have the intrahepatic and extrahepatic bile ducts. The hepatic ducts follow the vessel that drain the segment 2, 3, and 4, A and B. This is from the left main sectoral duct, and we have here a duct that draining the anterior part or anterior segment of the right lobe, which is a segment 4. So the ducts that draining the posterior segments, segment 6 and 7, to form the right posterior sectoral duct. These two ducts, the right anterior and posterior, the right posterior join the right anterior on the medial aspect to form the right main sector, form the common hepatic duct. According to the caudate lobe, maybe join the right hepatic or left hepatic duct. The intrahepatic duct is a tiny structure, is less than 3 millimeter in diameter. The right side up to 3 millimeter, and this is vary with age. And we'll talk about this variation in age in the next slides. The common hepatic duct, as we say, formed by union of the right hepatic and left hepatic duct. It is diameter and join the cystic duct after a variable distance, usually about 3.5 cm. It is usually formed at the exhalation. The cystic duct, which connect the gallbladder to the common hepatic duct. This is usually 2 to 3 millimeter in diameter and 3.5 cm length. It lie anterior, and this is the cystic duct. The common bile duct is formed by a union of the cystic duct and the common hepatic duct. This is usually 8 centimeter in length and less than 6 millimeter in diameter. The upper limit will be 1/10 the age of a subject in millimeter, or also an increase in diameter after cholecystectomy. The common bile duct have 3 parts. We have the supraduodenal part, which is the first part formed by the region of union of cystic duct and common hepatic duct. The retroduodenal part is posterior to the first part of the duodenum and run with gastroduodenal artery. And we have the third part, which is called pancreatic part. It is a common channel that open to the major duodenal papillae. Now we have a variation in biliary ducts. It is common. It's about 40% of cases, more at intrahepatic bile duct. This is the normal arrangement of medial side of the right anterior to form right hepatic duct, then union with the left hepatic duct to form common hepatic duct. This is the common of 65%. Now the variant side, and this is the common variant, 20%. Maybe there's a triple confluence with right anterior, right posterior, and left hepatic duct. Maybe the right posterior duct drain directly to the common hepatic duct, and this accounts for 5%. We have what's called the double hepatic duct with failure of union of the right